Hello scholars, my name is Dr. Kerris Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the subscribe button and don't forget to like this video. That way I can keep producing the videos that you like best. In the last video, we took a look at pica. In this video, we're going to cover rumination disorder. So let's begin. If you know what rumination disorder is, you're probably way ahead of understanding eating disorders. In order to have rumination disorder, the individual has to have the following symptoms. The person will continuously regurgitate food on and off for 30 days or more. The food that has been regurgitated may have been chewed, may have been swallowed multiple times, or may be spit out. B, the individual is not regurgitating the food because they have something wrong with their gastrointestinal tract or because of another medical condition. It is just happening. C, the regurgitation does not occur during another eating disorder surfacing, such as anorexia nervosa, bulimia nervosa, avoidant restrictive food intake disorder, or because of binge eating disorder. And then D, if the symptoms arise while the person has an additional mental disorder, the symptoms have to be severe enough to warrant clinical attention, and then it will fall into the category of rumination disorder. The condition will be considered in remission if the individual has not had symptoms of the disorder for a sustained period of time. When a person has regurgitation disorder, they'll experience the regurgitation of food usually after they eat, and then this goes on and goes off temporarily for a period of 30 days or more. However, partially swallowed food is brought back up into the mouth without involuntary retching, belching, or with any nausea. The food is either then rechewed and swallowed or taken out of the mouth. When a person has rumination disorder, the regurgitation will happen many times a week, if not daily. The regurgitation does not happen because of any type of eating disorder or medical condition other than the regurgitation disorder itself. This disorder can come about given any age and happens more often with those that have an intellectual disability. Generally, the disorder happens so often that it can be viewed easily by a clinician. The person themselves or their caregivers are the ones that are most likely to diagnose themselves before seeing a professional. Sometimes people say it's a habit of theirs that they just can't control it. There are infants that are seen with rumination disorder. The infant will first look like it's straining its back or arching its back, while its tongue is making motions kind of backward and forward, back to the throat and then back to the teeth and over again. Generally, the infant will look pleasurable while it is making this action. The infant might also be fidgeting and acting as though it is hungry in between feedings. Infants that have rumination disorder will often have trouble maintaining or gaining weight. The baby may suffer from malnutrition, even though the infant is constantly seeking more and more food. Malnutrition tends to happen when the infant regurgitates the food and then expels it out of the body. It is not unheard of for older children with rumination disorder to have malnutrition. If the parents are restricting foods to their children, malnutrition can happen faster for children with rumination disorder. If the child with the disorder becomes a teenager, they may have found ways of disguising the regurgitation either with a hand or by looking like they are coughing. This can be a devastating disorder for a child because they may choose not to eat around others, which can be really isolating. The age in which a majority of individuals acquire rumination disorder within infancy tends to happen between 3 and 12 months. In infancy, the disorder can come and go, and sometimes the infant may need to go to the emergency room for nutritional issues. This disorder can be fatal, though, especially in infants. For many of the infants and young children with rumination disorder, the regurgitation seems to have a soothing type of feeling, so they don't tend to like to see it go away. Children are at a higher risk of getting rumination disorder if their environment lacks stimulus, has too much stress, involves neglect, or there are problems between the parents and the child. Because children with rumination disorder are at a higher risk of malnutrition, this can affect their learning and basic development. Sometimes children or adults with rumination disorder can present with a low weight or continued weight loss. Sometimes doctors will refer to rumination disorder as rumination syndrome. It is important when a patient is talking about vomiting or saying that they're vomiting quite a bit that the doctor attempts to know or understand if the food is being broken down in the process or if it's coming back up fairly whole. This will let the physician know if the diagnosis might be rumination disorder. Now, generally, if a person has rumination disorder, it will take about 1 to 2 hours or will come about right after eating. This disorder is thought to be fairly rare and often gets misdiagnosed as something else. In the past many years, doctors are noticing more incidents of the disorder, but scholars are not sure if the circumstance is increasing or if it just is being noticed and then diagnosed more often. The cause or causes of rumination disorder are unknown. There seems to be some type of adaptation of the belching reflex that might be taking place with these patients. It is believed that there seems to also be some relaxation of the diaphragm as well. Patients that have rumination disorder often believe that they have severe acid reflux or some form of non-voluntary bulimia. The key to correctly determining if someone has rumination disorder is to take a good patient history and then conduct gastrointestinal tests to rule out other conditions. The reason that correct diagnosis for rumination disorder is important is so that a professional can work with the patient on breathing exercises both before and after eating to keep the diaphragm steady, because this is when the rumination happens, is when that diaphragm is not stable. All right, well, we have reached the end of this video on rumination disorder. I know it was kind of a topic that is not always fun to talk about, but it's important because people do have it, and I'm sure that there's a lot of anxiety and shame that comes along with it. So if you're experiencing these things, it might be good to bring that up with a professional. We're going to move on to other eating disorders, and then I've got about 45 other mental illnesses to go through. So thank you for sticking with me. Have a wonderful day, and I will talk with you soon.